Thank you so much. As for Zambia, the first key step the government took was to come up with a technical working group or a steering committee, just to look at what are the key gaps in all the key public health areas, and ensuring that they identify a gap. And from the gap that was found, there was a robust reprogramming of different activities, different priorities to focus on life-saving interventions such as commodity security for HIV, TB, malaria, and other few activities that were reprogrammed to ensure that with the shock, the government was now able to quickly trying to analyze that this is how we're going to move in terms of response to the global funding cut. So most of the solutions the government of Zambia is looking at is to come up with more innovative health financing mechanisms, having more into domestic resource mobilization, the introduction of sin tax, introduction of all taxes regarding specific products, which eventually the funds that will be realized will be pushed towards health. Then also looking at the long-term sustainability plan in place to ensure that there is projection on what is required, and also the focus on strategic purchasing is what the government of Zambia is looking at. Yeah, FH is crucial and is at the center of ensuring that there are adequate tools in place for government to respond to the current situation which is happening. And apart from that, FAH is actively involved in all the technical working group to make sure that the gap analysis is watertight and it is linked to data, and also it is adaptable by all stakeholders within the Ministry of Health, and also ensuring that there is more partner participation as well as engagement of civil society organizations who are at the grassroots level, who are also able to give us real-time information on how the funding cuts has impacted on community health services. Priorities for 2026, the first priority is to develop a long-term sustainable health financing for community health. And the second priority, most of the strategic documents like the National Health Strategy is ending in 2026, including the Community Health Strategy. And the priority will be to develop this, to support government in the development of these key policy documents, then as well as supporting government in the implementation of the PHC strategy, which is under development in 2025. So 2026, we need to support government in ensuring that the PHC strategy is up and running.